This program is a paid commercial announcement and in no way represents the views of WPH.D or its management.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
Well, we want you to, we want to do our best, I should say, to make you kind of forget about the cold. The Phillies will be opening spring training in 3 weeks. So how does that make you feel?
Wow, that's hard to believe, isn't it, John?
Right. So, think spring, think warm. Good to have you with us as always. Health Watch is the program, and you'll find us here, as you know, every Sunday, 8 till 9, Talk Radio 1210, WPHT. As you heard the man say, Dr. Molly is here. Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, located in Marlton, New Jersey. We will discuss today not only health issues, but what Dr. Molly and her staff at Innovative can do to help you and your family improve your overall quality of life. And if you want to discuss anything with Dr. Molly, as always, our phone lines are open here on the program, 855-839-1210, 855-839-1210. At any time during the course of the show, if you have a question or a medical challenge you want to run by Dr. Molly, feel free to call in at 855-839-1210. Not only is it cold, Dr. Molly, but you're busier than ever now.
Right.
That's good and that's bad, I guess.
Sure, no, it's good. It's good. A lot of very interesting cases have been coming through our doors. And, our philosophy is if we can help and improve your quality of life, that's what we're all about. We like to keep everybody on their toes in my staff. And believe me, we have been.
And you're working Saturdays now, right?
Yeah, well, we were working every other Saturday as of right now because that's what it warrants. But obviously, if somebody needs a Saturday and, it's very urgent or whatever, of course I go in.
All right, let's talk about Innovative Medical Associates, and let's talk about what sets you apart from what people typically know about primary care, primary practice. Sure. What's different about Innovative Medical?
Well, let's start with what's the same about Innovative Medical Associates in that we are a primary care facility. We work out of all of our healthcare providers are in a cooperative. We work out of the primary care facility, which is my facility, and we can do everything any place else does. Any like urgent care within reason or a primary care office, whatever your general practitioner could do for you, we can do. But the philosophy sets us apart in that we don't mind writing any prescription that somebody needs. They need an antibiotic. They need a blood pressure med. We want to prescribe that. Dr. Testa is a family practice guy. But what we like to do is augment prescription drugs with the more natural substances, the kind of things like vitamins, minerals, amino acids that you might find in the health food store. And by doing that, we can hopefully effectuate the change, maintain your quality of life, and keep you going in a way that's safer in the long run and minimize side effects from the drugs.
Now, typically, when you talk about primary care and you talk about physicians, you'll go in, you'll get a prescription, and maybe you'll get two prescriptions because
maybe you get three.
The second one and the third one
right.
have to counter the first one.
That's right.
So I guess what you're saying is that in your particular situation and your docs, they can prescribe.
Sure.
But rather than go three meds, if you don't need it,
right.
you'll go with some natural substances.
Exactly.
Right?
And what we want to do is utilize those by delivering it through hydration because we're able to deliver the concentration, the amount, bypass the digestive tract, and get you a direct hit to augment or to supplement, exactly right, supplement a pharmaceutical.
So in a way, what you're explaining is that this takes the place of another pharmaceutical.
It could, or it can certainly cut down a dose of a particular pharmaceutical. It all depends. What we want to do is be medically safe for the patient. I mean, that's the objective. But at the same time, we also want to give people a quality of life because, a patient of mine from a long time ago said, I don't know. I don't want to live to be 102 and be stuck in a wheelchair
Right.
and not have my senses. I would rather live, he'd say, I would rather live to 100 and be fully present. And I thought that was a great analogy.
You've often talked about side effects, and
Yeah.
I've often asked you this.
Sure.
About side effects. With the nutraceuticals and the substances that you use,
Sure.
do you find that there's been side effects?
Well, I can tell you that we use them so judiciously that, frankly, in our clinic, we haven't seen many side effects, maybe some lower blood sugar problem or something. But fundamentally, you want to make sure that the synergies of the nutraceuticals don't counteract themselves. And you want to make sure that the hydration products are very, very pure. And that's something I pride myself on because that makes a difference.
A lot of people ask you this, especially in the initial
I know.
consultation. They say, Dr. Molly, what's in those bags? I mean, what are you using? Is it like holy water? Is it
No, definitely not holy
So
water.
talk about the kinds of things you use.
Well, we use vitamins. We'll use minerals. We'll use amino acids. We'll use things like neuropeptides or cytokines and interleukins. So we try to use natural things that are usually found within the framework of the body. God's ingredients. You know, I feel that way. I use God's ingredients. The idea is we want to use ingredients that are as pure as possible and extracts that are food-based.
It's a good title for a book, isn't it?
Oh, yeah, sure. Yeah.
Okay, we'll talk about that a little bit later on in the show. But talking about the substances that you use,
Yeah.
we should mention that these protocols are yours.
They're
in other words,
proprietary.
what you get at your facility is yours.
Right.
You can't get this anywhere else.
No, the bottom line is this, John. Everybody knows vitamin C is vitamin C is vitamin C. I'm not playing that game. Vitamin C. But extracts of vitamin C, my belief is the body perceives food source differently than manufactured source. And the other thing that separates us from places that have a couple of chairs in their waiting room and they're hanging some bags is that we really concentrate on what we're doing as a medical modality. And that's the key. So when we talk about nutritional medicine, we're talking about nutritional medicine with the use of hydration as the vehicle to deliver the nutraceuticals to effectuate the change.
And you've often talked about, and in fact, there's been some places that have opened, and you use the term drunk tanks.
Oh, yeah.
You've
Sure.
often talked about that.
Hangover remedies.
Right. But
Yeah.
but this is not, you're fully
No,
focused on the
no.
medical aspect
We're
of it.
fully focused on, I want to take that. Yeah, we're fully focused on the medical aspect. I'm fully focused on quality of life for our patients. And that's the bottom line. Quality of life for our patients. Have people come in and just want to tune ups? Yes. Yes, but when doing that, we're not just going to say here's your hangover remedy. No, we want to talk about your history, your medical history. I want to know what medications you're on. We're not just going to throw you in the chair. It doesn't work like that. You go to a spa, it works like that. So bottom line is when we sit down with you, we're looking to effectuate change in your quality of life. Can I cure cancer? I can't. Dr. Testa can't. Nobody can, as far as I know, even the oncology people. But we can improve your quality of life whether you go through the cancer treatments or not.
Well, we're going to talk about that after the break.
Sure.
We're going to talk about it, and I know one of your cornerstones of your practice is cancer support.
Oh, yes.
And we're going to talk about that a little bit later on in the show. But we are coming up on our first break of the morning. Our show is called Health Watch. You'll find us here every Sunday, 8 till 9, Talk Radio 1210. WPHT, and as always, our number here in the studio is 855-839-1210, 855-839-1210. If you have a question for Dr. Molly or you have a medical challenge, and maybe you're thinking about, we're talking about certain things, and you're thinking, well, because this possibly help me, well, just call in, and Dr. Molly will be happy to talk to you about it. 855-839-1210. With Dr. Molly Fantasia, I'm your host, John DeMasi. We return more of today's Health Watch after these words. Back here on Health Watch, as always during the show, operators are standing by at Innovative Medical, 856-489-0505. 856-489-0505. And we give you that number because a lot of times people say, I'm kind of bashful to come on the radio. So you can call the operators, and they'll be happy to answer any questions that you have. And if you want to make an appointment with Dr. Molly to sit down and go over your particular situation, we call that the initial consultation. That's complimentary. And that's really where you get a lot of your information that you may need to make a decision as to whether you want to move forward or not. So pretty simple process, actually. 856-489-0505 is the number. Innovative Medical Associates, Marlton, New Jersey. And again, the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. Also, a lot of good information on that as well. Health Watch is the show, Sundays 8 till 9, the live version here on Talk Radio 1210 WPH.D. Again, the number, if you want to talk to Dr. Molly right now on the radio, 855-839-1210. Dr. Molly, we talked about cancer and cancer support, and this week I understand you had a few new cancer patients
who came in for the free consult. Yes, and there's been an evolution in cancer care, certainly in our facility, in the cancer supportive care. Patients are coming in, and in the very beginning when we were doing this, and I've been around for 25 years, John, something like that.
I think you said 27 last week.
No, I don't. Maybe you said 27, but okay. I don't know. But anyway, bottom line is, it's been a very interesting movement. Probably 20 years ago, people really were hesitant if they were doing traditional cancer treatment, which I mean by radiation, chemotherapy, in addition to the surgery to remove the tumor if possible. They were hesitant to come to a place like what we have. All of a sudden, the oncologists are starting to realize that this is patient-driven. Their patients are saying, well, I understand you want to put me on immunotherapies. I understand you want me to have chemotherapy. You want me to have radiation. Well, how do I maintain some quality of life through this? Well, they're seeing that patients are more educated and want to then go to a place where they feel safe doing just that, getting the nutrition they need to maintain their quality of life through traditional cancer treatment.
So patients are getting more educated because I guess there's more information out there about these kinds of treatments. Of course.
Now, I will say that there's a limited amount of healthcare providers who are involved in what we do, but they're becoming much more educated in the use of nutraceuticals through traditional cancer treatments. And I find that's very, very interesting, and it really is very enlightening for me because it makes the patients who come in ask really profound questions.
And what could a patient expect? In other words, sometimes people don't know about this and they hear you on the radio and then
Sure.
They come in and they talk to you and if they didn't hear that, they wouldn't know about it. But what can patients expect from nutraceuticals or from your protocols?
Well, I can tell you that, for example, your good friend vitamin C.
Yes,
vitamin C is known now, pretty well known throughout the country as an adjunct to some cancer protocols, meaning traditional cancer treatments, like from the oncologist. And the thing is, people come in now armed with information. Oh, well, my oncologist said vitamin C is very bad because it's an antioxidant and he's creating free radicals. And I explained that at a certain level and used with other synergistic nutraceuticals, vitamin C can become a prooxidant and actually intensify your treatment as well as keep you going through it. So people are getting wise to these things. This week I had a wonderful woman and her daughter who came in, very fine people, I could tell. They came in and the daughter was armed with all of these questions for me, doing research, using Dr. Google, I will say.
Yes.
Okay, but she was pretty educated. She was asking questions about how this would affect her mother, and they were good questions, and I think we answered them to the best of my ability. Now, one of the questions that she asked lovely Linda when I left was, I would like to have exactly what is in my mother's bag. So Linda came back to me and I said, well, you can tell her the basic stuff that I use, but it's the synergies. Again, I'm going to tell you, it's how we use these nutraceuticals and the additions of certain low dose homeopathics that actually really set our cancer protocol apart.
We should mention also that your protocols are proprietary.
Yes.
So when
right.
people ask you, you can give them in general,
right.
but you
and
can't
I
give
will.
them. You
and
can't
I
give
won't.
them.
I won't.
Right.
I won't. I won't.
Well, Coke doesn't give out the recipe. Remember, I told you that.
Yeah, I know you said that before. But I do find that funny because even let me tell you, folks, go into your neighborhood health food store and pick up some multivitamins, and you'll find that they'll say a proprietary blend of.
Right. Exactly.
And that's exactly right because they spend a lot of money, and so did we. By the way, I have 20 years worth of research in this, and we've spent a lot of money in doing this because remember, when we started, all the R&D, okay, the research and development had to be done at our facility on us, okay, back in the day, meaning Dr. Veach, myself, and the entire clan that I had at that point.
So there was a lot of time, too, that went into
Absolutely,
this, right?
and there's a lot of time that goes into it now. Really, you don't spend the kind of time. You don't just come in and bang, we throw something together. It's not like that. I really look at the chart. I want to know where you're at. I want to review some of the oncology notes. Very important. And if I have a question, I'm going to call up my consulting oncologist and ask him, hey, what do you think about this, this, and this? So it's not easy.
And you have a lot of, a rather large network of people that you talk to
Sure.
and really get information from.
Absolutely.
I mean, you're part of some national networks.
Correct.
That are do this kind of thing
right.
on a regular basis.
Right. And boy, since COVID, we've been doing more of this over the computer, and I will tell you, we're all anxious to get together again and exchange ideas, flying out to conferences. I have to tell you, and that's the other thing, John, we're talking about our cancer supportive care. You know how many people are coming in and saying, I'm very concerned because my oncologist is not readily available through COVID. I said, what? Well, they sort of beam him in, Scotty. So it's like, what? It's like,
it's
really?
Zoom.
It's like, what? I mean, it's really scary today. That's all I can say.
Well, what can people expect? Cancer protocols, what can
supportive,
they expect?
Yeah.
Cancer supportive protocols. What can they expect? Is it once a week, twice a week?
It really depends on what kind of cancer, where you are. I just said to you earlier in the show, how I wish people would come to me when they're first diagnosed. Right? No, generally it's after 2-3 rounds of chemo, and now the cancer has progressed to a stage 3, 4, and whatever. Boy, wouldn't it be nice to come in at the early stage so that we can get a foothold on helping you move through your cancer continuum and possibly extend your quality of life through the whole thing.
Sounds like when they are diagnosed, even before they see their oncologist, or maybe right after, they should be contacting you.
You would be helpful.
Because then maybe you have a better shot at helping them longer and maintaining
the quality of life. But here's the thing. You know what happens when you get a diagnosis of cancer? You're stunned. You're stunned.
Oh, sure.
And we're bombarded with these images, by the way, on all of the TV ads. Oh, you've got to go here first, or don't. Yeah, what you don't want to do is you don't want to stay in inertia. But just remember, the day you're told you have cancer, you've had cancer way before that.
Right.
That's the other thing. The other thing is just think about maintaining your immune system, something we talk about all the time, John.
And you were mentioning earlier about an oncologist, and you had a patient who kind of talked to the oncologist, and she went back, and it was like, well, what can you do more, or what can you do further?
Right.
Like
actually, this is interesting.
The doctor was favorable to what you do.
Exactly. In fact, she's a wonderful patient, Kathy. She's been with my clinic now for over a couple of years. She's very particular about going to her oncologist, making sure she does all the follow-up, and she generally has some pretty good blood results. But this time the oncologist said, one of your analytes is a little low. How about you ask Dr. Molly what she can do to help you with that? And indeed she did, and I'm working out the plan now in my head.
Which, that's the other thing we should tell our audience. that your wheels are always turning. And
Well,
I could see sometimes you walk in the clinic and you're talking to a patient, and you're talking to another patient, and then you leave. And I said to myself, I know the wheels are turning about that conversation.
Well, I'm very lucky because my medical folks, my providers, are all wonderfully. We tend to do, they talk about tumor boards. Well, we have our own little board meetings going on, and I'm grateful to all my providers and their input and what we need to do.
What can you tell people besides, trying to get in as early as possible? What can you advise them if they have a cancer diagnosis?
Not to be in inertia. Let's do some things. Let's change up some diets. Let's look at all the research out there about nutrition and cancer support. And let's really get on the ball and come in, see us, and see what we can do to help you get through this. And we've done it fairly successfully for the last 26 years.
And the reason being, you've often said about the immune system, and sometimes post-chemo, your immune system is compromised.
Right.
So this
Right.
hydration helps that.
Exactly. Well, the hydration is the vehicle by which we can give you the actual nutraceuticals, the substances that can help you improve your own immune system. Here we go again. One of the other things that's interesting about the cancer supportive program that we do, we found that 98% of our cancer patients, when we run blood work, they have some viruses. This is interesting. In the blood, they have antibodies to certain viruses. Not things that are deadly viruses, but viruses. And why is that important? Because the immune system tells me it's been fighting these viruses for years. Well, you don't think that over the course of years that takes a toll. So in our cancer supportive treatment, depending on where the patient is in the continuum of their care, we may use some natural antivirals in their protocol in order to help the immune system not fight on all fronts.
Time flies when you're doing this show. We're at the halfway point already. How about that? Huh?
Wow.
But we have plenty more to talk about here on the show. And at this point in the program, I usually mention to you that we do have some time left on the program to talk to you. So if you have a question, this is a good time for you to call, because it happens to us just about every week. Somebody calls and
at the end
of the show, and we can't get to you because we're at the end of the show. Pretty simple about that. 855-839-1210. Now's the time to call. You got plenty of time, and Dr. Molly can take the time to talk to you and kind of help you out with whatever your situation happens to be. 855-839-1210 is the number. 855-839-1210. Our show is Health Watch, Sundays 8 till 9. Talk Radio 1210, WPHT, with Dr. Molly Fantasia, the PhD doctor, the executive director, and the founder of Innovative Medical Associates. I'm John DeMasi. We both return. More show after these words. Welcome back to Health Watch. As always, operators are standing by at Innovative Medical Associates, and they are there right now, of course, 856-489-0505. When you call, you can get more information, and certainly you want to book an appointment with Dr. Molly, 856-489-0505. That's the number, 856-489-0505. Also, a lot of information on the website, innovativemedicalassociates.com. innovativemedicalassociates.com is the website. Feel free to check that out as well, including previous programs. We have all of the radio shows are on there, so you can check out that and get some more information. So there's plenty out there for you. Again, innovativemedicalassociates.com is the website. Our show is called Health Watch, of course, and you'll find us here live every Sunday, 8 till 9, Talk Radio 1210, WPHT, and the number here in the studio is 855-839-1210. Another area, Dr. Molly, that you've had a lot of success with over the years and continue to do so is autoimmune.
Autoimmune. You know how frustrating it is for people who suffer from chronic autoimmune conditions?
I'm sure it's very frustrating.
Very frustrating, particularly the pain syndromes and this type of thing. And fatigue, like the chronic fatigue patients that I have. And believe me, I feel for them when they come in and they say that the physicians have told them it's all in their head. And really, because maybe their blood work doesn't show enough of a particular analyte to absolutely say that's the condition. And you know what's interesting? I believe there are so many subsets of these conditions that people may only show up with 1 or 2 analytes out, and you need 4 to make the differential diagnosis in the conventional sense. But you know what? We treat them as if they have the challenge. What we want to do, again, through the autoimmune, is really have their own immune system come back. How is that done? It's done with, of course, vitamin C, but it's done with many other things. For example, we might want to use things like the amino acids. We might want to use things like peptides. We're looking at things that help develop the messenger molecules that activate our own stem cells. These are the kinds of things that I look at when I see a patient with an autoimmune condition. Rheumatoid arthritis, terrible, terrible condition. And you all know my patient Sandy. She's been with me for quite a while. Yesterday, we actually did an injection in her knees in order to really promote actual healing in the knee. We had done an earlier PRP, which is platelet-rich plasma in one knee, and we followed that with all of the growth factors needed through the hydration in order to cement that PRP, in order to activate it, to let it work. And now, yesterday, it was like 2 months later, she's coming in for the other knee. So she had great success on the one side. And you got to understand, that's a very debilitating condition. You've seen her.
Oh, I've seen her, yeah.
Right.
Yeah, what we see now is good.
That's
Yeah,
right. Now, again, I can't say it's holy water, right? She's
Right.
still walking with a cane.
Right.
But boy, she wasn't walking with a cane when she first got in.
Right.
She could hardly walk at all. So this is the thing. These are the things that really resonate with me and actually resonate with my nurses, my staff, because, again, we like to see patient success. And success may not be measured in cure. Success is measured in all of a sudden you're able to spend more time with your grandkid. You're able to get up in the morning and have coffee with your wife or husband or significant other. These are the things that we look at. These are the things.
All right. You've often talked about PRP. For those who may not have heard previous shows, platelet-rich plasma is
Yes.
what it stands for.
Right.
But what is that?
Actually, it's pretty interesting. You're drawing the blood from the patient. We have a very special centrifuge that separates the blood into the components, which is the solid part, the red blood cells, the serum, and then the platelets, which are really loaded up with growth factors. And what is done then, it is re-injected into the patient, into the area that is really giving the patient the problem, knees, elbows, shoulders, etc. So PRP has actually been approved at this point as a bona fide medical treatment option for patients. It's used extensively. The athletes use it extensively, in order to heal elbows and knees, etc. If you read, particularly in the basketball and football kinds of injuries. So, yeah, we use PRP, and we do things a little differently. The PRP is one aspect. We inject it back into the knees. But then what we like to say that is putting the seeds in the garden, and now it's time to water the garden. We do that through the hydration therapy. So our protocol calls for a 2-step program.
Is this your own? In other words, you're
this is our
regrowing
protocol.
you're regrowing your own.
That's right.
Okay.
You're actually re-healing your own injury with your own immune system. That's why it's so important. Our immune system is our lifeline, John. Listen, you and I have sat here now how many weekends, and all we've talked about is COVID.
Yes.
Right?
Yes.
And why?
Right.
Because people are scared to death about their own immune system through this.
Right.
Right? So one of the things we look at is, why aren't we focusing in on how do we stay immune healthy and not immune compromised?
And one of the ways is
through the hydration
right.
and utilizing the nutraceuticals that God has given us to do just that. We are an amazing. Our creation is amazing. It's amazing. The body is an amazing thing. Here we are. It's just unbelievable. And we have the ability, we all have the ability to help improve our own quality of life by utilizing many of the things that are placed here on earth.
And how many times have you and I talked about vitamin C, And people are amazed when I say I haven't gotten COVID. I say I get 2 vitamin C treatments a
God
week.
bless you.
Right.
Right. But
really?
you know what?
Wow.
And you carve out that time, and you're a busy guy.
Right.
You do shows. You have other shows that you're doing, your own show that you do. Come on. You're a busy guy. If we really sit down and think about it, we should make a priority to do our own immune systems all the time, because God knows there are so many things assaulting us now. The environmental stuff, right? You're in a building like we're in right now. Mold. You don't think we have mold in this? But we're right here down the shore, right? Of course we do. You and I, I really believe that people have to learn to take charge of their own health. And one of the ways you can do that is vis-a-vis hydration therapy.
And you can come in. I mean, talk about this, because I come in twice a week, but you've often said I've got comorbidities.
Right.
And that's what you have suggested
Of
that
course.
I do.
But there are other people.
I mean, you can come in once.
You can come in once every 3 weeks.
Right.
If you've been a patient of mine and we've worked with you before and you're doing well, you don't have to go steady with me, but you'll know when it's time to come back in. And what we don't want you ever to do is cause your immune system to lose its reserve and put you at risk. Look, this is not a cure-all, but boy, this helps a great deal, and especially with all of what's going on right now in the world, John.
Talk about, you've mentioned this before, peptides. What is that, and how does that fit in?
Well, peptides are small chain proteins, very, very important. And in particular, there are neuropeptides that the body uses to regulate hormonal levels. And peptides, you have to use them carefully. In fact, athletes know a lot about peptides because they use it for muscle building. It is a protein. You'll see the shakes, etc., in the health food stores, right? The powders. So we use peptides in a certain way to enhance certain functions in the body to just improve the particular functions of organs. For example, we can use things that we use to improve the liver. We use glutathione, which is an amino acid, a larger amino acid, but I might use something that is actually an interleukin, which is a peptide of sorts, work specifically on the liver. And again, these are proprietary in nature. The peptides themselves are not proprietary. They're here in nature as they are right now. But they are proprietary in how we utilize them in our protocols.
So this is not just for athletes?
No,
okay.
no. There's a lot of reasons to use some of the low dose physiological re-regulating meds that we use. Absolutely. And again, they're homeopathic in nature. So they're natural.
Okay. Well, everything you have is
try.
natural. Yeah.
We try, yes.
Right. But when you say the peptides, and when you say it's not just for athletes, but who would it benefit, or what kind of person?
We use peptides for our cancer patients as well. Again, these low dose re-regulating peptides that we use have a place in our certain protocols to what? To help reduce inflammation. We're back to that. Look, the age-old devil is inflammation. Inflammation is good. Inflammation can be bad. Good inflammation is, when you have trauma or a cut, you want your body to go into gear and heal that wound, right? But you don't want it to go into overdrive and cause another issue, which happens with inflammation. You turn it on and you can't turn it off. That's how you have autoimmune diseases.
And you have often said there's good inflammation and there's bad inflammation.
You bet. It's like good influences and bad influences. You got to watch.
Over the years, I guess it's kind of hard to determine, but you've had success with cancer patients and cancer support.
Sure.
But what other kinds of situations or other kinds of conditions?
Chronic conditions,
right.
Lupus patients, people who have a hard time, the rheumatoid patients, people who have pain syndromes. It really depends. It's an amazing week at our facility because when people come in with their challenges, there's never a dull moment. It's not one thing.
I know.
It's never a dull moment, and there's always something different going on, even in terms of whatever condition, because the nuances, listen, we're all individuals, and we have individual nuances that are going on biochemically for each and every one of us. I mean, we're all created in the image and likeness of God, but there's so many nuances in terms of that.
I have to mention your book, God's Ingredients, TOO, your latest book, your 30-year journey in IV nutritional medicine. You could probably write volumes of books, right?
Well, you know what? What I really like to do is tell the stories, because the stories stay with me. When you come into our clinic, the stories, the patients stay with me. And a happy ending is not always what you think. For example, I had a cancer patient who was told she was only going to be around for 3 months. Well, 3 years later, this wonderful gal, Mary, was still with me. 3 years and 4 months. She was still with me and doing well. And in the end, I mean, she had cancer in various, it was rough. She was doing conventional treatment, but her way. She was going up to see my oncologist. And between my oncologist and myself, we gave her almost 37 months. But the interesting thing is, her last few days were not terrible. She fell into a deep sleep. She was good. She was cognizant. She knew people were there. And then she quietly passed into the good Lord's arms. That's a win for me.
Right.
That's a win.
And I remember her because...
Well, she was rough.
Because,
she was fun.
No, you had mentioned on the show about her conditions and her challenges. You looked at her, you had no idea.
She never lost a hair. She never lost a hair in her head through chemo.
Exactly. You had no idea. You thought she was just in there.
She was political.
Right. Oh, yeah. Yeah. And she used to listen to my show, my other show.
That's
and she would tell me, she said, you know what, I heard you talk about that.
And I agree. And this is like, she was rough. So the point is, she had time to spend time with her grandchildren and her children. And it was certainly well beyond what the traditionalist told her she was going to have. And again, I want to say she did both worlds. She did conventional chemotherapy in a non-conventional way. And I'll tell you what, I believe that was a success for us. That was a success.
We are coming up on our final break of the morning, and that means you still have some time to jump in with a question. 855-839-1210. 855-839-1210 is the number here. And the show is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPH.D. Again, that number, if you got a question for Dr. Molly, better call now because we got a couple minutes left of the show. 855-839-1210 with Dr. Molly Fantasia. I'm John DeMasi. We're coming back. More Health Watch after these words. Back here on Health Watch, and again, operators are standing by right now at Innovative Medical, and they will be there well after we leave you at 9 o'clock. 856-489-0505, 856-489-0505. That is the number. People say you read the number too fast. Okay. 856-489-0505. Innovative Medical Associates. Write it down. Marlton, New Jersey. Also, the website, innovativemedicalassociates.com. innovativemedicalassociates.com. Don't forget, if you miss any of today's show, we have our Health Watch replay this afternoon, every Sunday afternoon, 4 till 5, here on Talk Radio 1210 WPH.D. A couple of minutes left of the show. 855-839-1210 is our number here in the studio. Let's talk to John in Marlton. John, good morning. Welcome to Health Watch.
Hey, John.
Good morning, Dr. Molly. John.
Hey, John. My favorite John is on the phone.
Yeah, I was in last week. Well, I'm in every week, but I was in last week, and one of the patients was talking there, and they had to get a blood test.
Yes.
So he said had to stand in a line for an hour. He pretty much froze to death outside of the place waiting to get a blood test.
Right.
I said to him, what are you doing? Why don't you come here and get your blood test? And what was surprising that he didn't realize it. I don't know how he missed it, but what you do when you do a blood test, you do everything that the doctor specifies.
Of course.
With me, it's my heart, my cholesterol, HDL,
Sure.
LDLs, what have you.
Sure.
But you do another 25 or 30 other tests for what you need in your system.
Of course.
Which you're not going to get from the doctor because he doesn't request it.
Well, you know what?
I think that's very important. I really do.
Thank you, John. It is. Here's the thing. That's my poor guy Sal. Right now, it's so interesting to me because I've drawn the blood for his treatment protocol. but he never put it together, and I didn't know that his cardiologist wanted some more work. If he had just brought the script into me, I would have done it from the very beginning. So you heard what he said. I'm never doing this again. I'm not, Molly, I'm with you. I'm not standing in that damn line. I said, you know what? He said, I don't care if it warms up to be Palm Beach weather. I said, I'm with you, man. So, yes, of course, we're full service, right? And we try to be.
Yeah, it makes difference, because you find out what I like about it is it shows what additional vitamins I need or don't need.
Right.
Which I think that's a real plus.
I agree, John.
For a patient.
And go ahead, sir. Yes.
The other thing you were talking about Kathy, I'll tell you the truth. I've met her a few times. A very nice lady.
Yes.
And you never ever would know that she had cancer 3 times. Never. To look at her complexion, her color. It's just, I was amazed. I didn't know it. I would have bet no way.
You, John. I believe the good Lord had a lot to do with that, but we're trying to do our part, for all our patients, cancer or not. Bottom line is we listen, we truly love our patients. That's a fact. My staff, the lovely Linda.
We know that.
We love you guys, and it's because we know you have a brain in your head. The bottom line is most of our patients are thinking people, and that's very, very important, John. You take your own health seriously. God bless.
Yeah, you have to do that.
Thank you.
All right, dear.
Thank
you, John,
guys.
thank you.
Thank you.
Happy Sunday. Stay warm, John.
Yeah, he's the best. John, he brought up a very interesting point. I want to say something else. I'm big on DNA testing when it's appropriate. But I don't use these what I call kiddie tests, right? We're using something that's true. This week, one of my patients, Pamela, had to come in because I got an alert on a test that I took for her 2.5 years ago. And she's still my patient. She was my patient then. But this particular genetic testing, every time a new gene has been identified, and there are new ones coming up related to a new condition, this particular test contacts me and tells me what is going on for my patient. And in this case, it was a very important particular gene sequence because it could affect her if she has surgery and general anesthesia.
How about that?
That is a true story, and it just happened this week.
And that is truly amazing.
It is, because I used the right test. As you remember last week, somebody called about a hair analysis or whatever, and I said, yeah, okay. But I believe that certain tests have to be done by certain types of clinical laboratories that are extremely important, that you know where you're sending these to, and that it's truly a good fundamental test that is accurate as well as precise.
All right, let's talk about an area that really you cut your teeth on in the very beginning of your practice, and that's cardiac care.
Chelation therapy, cardiac nutrition, and last week we talked a little bit about that. But I was thinking the other day about one of my wonderful early patients who was with me well over 15 years, right?
Yes.
And he outlived his entire family. His entire family died in their 40s and 50s from cardiac. Hardworking guy, very well known in Philadelphia. And I will tell you, the win for me in that, although it was very hard, the win for me in that is how he passed away in his sleep, where his brothers, his father, and the entire family passed away in their 40s. He went to his mid-70s. And that's a win.
And he
worked until the day he passed.
I remember he used to tell us, I'm in there at 4 o'clock in the morning.
That's right.
And I remember one day I said, why? He said, well, I can get a lot done then.
That's right. And that is a win. So, folks, can hydration make you live forever? No. Can hydration, though, give you a quality of life until the Lord calls you home? Yes. Yes. And I firmly believe that the nutraceuticals, the immune system, can be tuned up in high gear to keep you safe from all this stuff out here. I'm not saying you won't ever get COVID. I'm not saying that, John. But I bet you, and I've seen it, we can get you through the COVID.
Absolutely, and you've done that.
And we've done it.
Right.
So really, I think people really have to believe that they have to look internally and know you must take care of yourself, and you should utilize any of the tools we have out there that God's given us.
And, when you talk about cardiac, it's again about chelation and just briefly talk about blood flow and all of that.
EDTA, it's plaque X, phosphatidylcholine, cardiac nutrition. There's just so much, depending on why you're see me. There's a lot of things that affect cardiac. For example, if you have an arrhythmia, you might want to use an amino acid that we use. So, again, it's not one size fits all, John. It depends on what we are trying to accomplish and what the providers and I come up with.
And that's why the initial consultation that you do is free. But it's important because people can actually see the facility,
sure.
and they can talk to patients, and
Absolutely.
they can find out more and really get their questions answered.
And not only their questions answered, but we probably can go through some of their nutraceuticals that they're taking at home and making sure that they're getting something that's good. And we want to talk about that. It's not just the hydration that we do. We actually put together a protocol of nutritional supplements that you might need, but good quality.
And with that, we put the wraps on another edition of Health Watch. Don't forget, if you miss any of today's show, you could check it out this afternoon. It's our Health Watch replay from 4 until 5. And operators are standing by right now. And just because we leave you at 9 o'clock doesn't mean they're going home. No, they're there. 856-489-0505. 856-489-0505. And check out the website. A lot of good information there. InnovativeMedicalAssociates.com. InnovativeMedicalAssociates.com is the website. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, Barbara, delightful Dee, fabulous Fran, Joanne, and our nurses Jess and Lana, and our medical assistant caring Kathy, I'm John DeMasi. Thank you for listening. Stay warm. Have yourself a safe and a healthy week. We'll do it all over again next Sunday. Health Watch, 8 till 9, Talk Radio 1210, WPHT. You take care.
This program is a paid commercial announcement and in no way represents the views of WPHT or its management.